insurance company overhead is 14%. And they know the people are going to take the lower premium in the government plan, or they're afraid of that. So they say, we can't, you got to put us on a level playing field. Well, you can't make profit off people's sickness and have a level playing field with a government plan.
Let me ask Congresswoman Schwartz that if indeed the private insurance company are fighting against the public option, does our legislation demand that a person has to join the public option? How does that work in our legislation?
Well, it's a really good question. I think this has also not been clear. Of course not. We are not in any way telling people where they have to get their coverage, where they have to buy their insurance. If, in fact, people get a subsidy, and really understand that everyone's going to have to pay something. Really, we're not giving away too much free here. You know, this is really, everyone's going to pay their share, and we're going to help people. But we're also saying to them, and we've said to the insurance companies, fine, come in and compete. That's great. We're going to create a marketplace where you can offer new products to another 30, almost 40 million people. And then each of those individuals or families or very small businesses will be able to choose between private insurance companies and a public option. I mean, I see that the public option is an opportunity to ensure that there really is competition. Because I think in many of the markets across the country, we have one major insurance provider. That's it. So not a lot of competition. If we believe in the free market system, you need a little competition there. If you only have one product to buy, well, and it's very expensive, you don't have a lot of choices. So what we're trying to say here, and the insurance companies, I want to give them, you know, I'm happy to beat up on insurance companies, but I will say, they have said if everyone's in, they want to be able to have the opportunity to sell a good product to people. That's fine. We're fine with that. We want them to step up the plate and offer new insurance product to individuals and small groups. And again, as Mr. McDermott said, make sure that it covers certain benefits. It doesn't exclude people. It doesn't cherry pick, as you say. There are going to be rules, and we're going to make sure that consumers are protected and under these rules. That's very important. But no one is going to be told to go into the public option. No one.
Well,
they can choose the insurance.
I've heard the Republicans say on this floor, in this House of Representatives, and other on television, that this public option that's being offered to people to take if they want it is really a democratic, socialistic, communist attempt to knock out the private sector. Where do they get this idea, and what do they mean?
It's very strange. And people who talk about believing in competition and believe in the marketplace, as Senator or Representative Schwartz says, there are places in this country where there's only one option. And if you have nobody to compete with, they control the prices. And for them to get the idea that it's socialistic to put somebody in there to compete is really saying they're afraid to compete. They know they can't win. They have failed over the last 18 years. They knocked out Mrs. Clinton's efforts in '93. They had an open field. The entire country was open to the private sector. And they cannot figure out how to cover 50 million people. So we come stepping in and say, we have a way. And they say, oh, no. You can't. You'll somehow, if the people ever get a wind of what you're doing, why, they'll leave us. They're afraid that people will leave them because they have been in it for the profit and not in it for the benefit of the patients. And that's really why I think they're afraid.
Well, some of the private insurance companies say we just don't have enough resources to take care of all these poor folks that you're giving subsidies to. Let me ask you, Congresswoman, is there anything that we're doing to provide the workforce and to provide the environment so that sick people can feel secure in getting health care once they have the subsidy?
Right. Well, and understand the subsidies we're providing. Poor people in this country do get Medicaid, and we're expanding that. These are really people who work, and many poor people do as well, work every day and simply don't make enough money to be able to afford the high rates of insurance. And that's part of it. We want to bring down the cost of insurance. Again, we hope that the private insurers step up to the plate and help us do that, but they haven't done a great job of containing costs over the last number of years, which is why we're in this situation. But once people have insurance, we are really working hard to make sure that the delivery system, all those doctors and nurses and, well, you can name all the other health providers, are